Here in New Brunswick, we know this struggle all too well. Whether it is a family in Miramichi waiting weeks for a doctor's appointment, or an Indigenous community in Tobique First Nation facing barriers to basic care, the challenges of accessing healthcare in rural and remote areas are deeply felt. This story from Dawson Creek, reported by CBC News, shines a light on the urgent need to address healthcare shortages, particularly for specialized services like obstetrics and gynecology. It's a story about people, mothers, families, and healthcare workers caught in a system stretched to its limits. So, folks, what does it mean when a small town loses its only specialist? How does this ripple out to affect families, communities, and even the healthcare workers trying to fill the gap? And what can Health Canada, provincial governments, and local communities do to fix this? Today, we'll unpack the Dawson Creek crisis, explore its roots in Canada's healthcare system, and connect it to the challenges we face right here in New Brunswick. We'll hear from healthcare providers, patients, policymakers, and we'll ask, how do we ensure equitable access to care for every Canadian, no matter where they live? Let's get started. To understand why Dawson Creek is without an OB, we need to step back and look at the broader picture of Canada's healthcare system, particularly in rural and remote areas. Canada's universal healthcare system, governed by the Canada Health Act of 1984, promises accessible care for all. But for decades, rural communities have faced persistent shortages of healthcare providers, from family doctors to specialists like This isn't a new problem, it's a chronic one, rooted in geography, demographics, and systemic challenges. Since the 1960s, Canada's healthcare system has grappled with uneven distribution of medical professionals. Urban centers like Toronto, Vancouver, and Montreal have historically attracted more doctors and specialists due to better infrastructure, higher salaries, and lifestyle amenities. Meanwhile, rural areas, including Dawson Creek and parts of New Brunswick like Restigouche County, struggled to recruit and retain providers. A 1971 report by the Canadian Medical Association noted that rural communities often relied on a single doctor or nurse to serve thousands, a pattern that persists today.